Some lifestyle choices could be contributing to a serious medical condition that's becoming increasingly common. And so the doctors are actually starting to take notice, and that's why we brought in Dr. Joseph Salhab to talk about fatty liver disease. Is that right?
Yeah, absolutely.
Great to have you.
Thank you so much for having me.
Thanks for stopping in. When I think of liver and I think of problems and I think of having too much fun, I think of drinking. Right? So you drink too much, that could affect your liver, but is it true that you can actually have non-alcohol related issues with fatty liver?
Absolutely. So the two most common reasons to have fatty liver disease are alcoholic fatty liver disease, so it's in the name. And the second one is called non-alcoholic fatty liver disease, and that's actually related to things like high cholesterol, diabetes, obesity, poor diet, and it can also cause essentially a similar thing where you get this toxic amount of fat that's deposited on the liver, and that type of fat is different from the fat that's underneath the skin. When it's on an organ like that, it tends to be very inflammatory, it tends to cause scarring and damage over time.
Okay, so it is what it is and what it says. It's just fat in the liver, and it's what, preventing it from doing its job, essentially?
Yeah, that fat on the liver is very toxic, and it releases a lot of toxic chemicals. And what happens is when the liver is damaged for a significant amount of time, it becomes to get scarred. And when a liver's scarred, it can't work the way it normally works. And then eventually, it becomes so scarred that it stops working, and then you end up with liver failure.
Is this common for most people, or who's going to be affected by this?
Oh yeah, it's increasingly common. We estimate that about 100 million Americans right now have some form of fatty liver disease. So as you can imagine, probably within the next 2 or 3 years, it's going to be the most common reason for liver disease in America and the most common reason to need a liver transplant.
And to prevent it, I'm going to hear, don't drink so much, get your sleep, and work out. Are those some of the things that are going to, what can we do to make sure we don't get it?
Absolutely. A lot of it really is related to lifestyle, and it's very preventable. So the first thing is, you got to really tone down the alcohol intake. And then a lot of it is related to your diet. So you're going to want to eat more fruits and vegetables that are high in antioxidants. Things like, berries, things like nuts, green tea, coffee, we know is actually very healthy for the liver. You're going to want to maintain a healthy weight, so that includes things like exercise, eating the right amount of calories, and then also taking things out that are really high in refined sugars, things like sugary drinks, which we know is just toxic to not only the gut but the liver as well.
Right. And after the pandemic, I think a lot of people kind of leaned on alcohol a little more. So is there any advice to what's too much drinking? How many drinks is too many? Is there guidelines for that? Yeah,
there is. So we think that a moderate amount of drinking includes about 6 drinks a week. So that includes just a 5-ounce, glass of wine, or even just a 12-ounce bottle of beer or can of beer. So we think that more than that, you're kind of bordering on the high end. So, it's always good to just kind of be mindful of it and try to tone it down.
Those are the rules, people. Pay attention. Hey, you have a big following on Instagram. What's the handle so people can check it?
It's The Stomach Doc. You can find me on Instagram, TikTok, and Facebook.
The Stomach Doc. Easy to remember. Go check him out. Follow him. We have much more to come. Thanks so much for being